Hi, my name is Annika Dunning, and a therapeutic relationship that I have been able to witness during my healthcare experience was when I was working in an outpatient women's health clinic. At the clinic, we took care of patients who were starting their pregnancies, in the middle of their pregnancies, ending their pregnancies, patients who needed female care. And so, one of the patients that I interacted with, there was quite a few patients that had this particular experience, but one in particular that I personally cared for, there is a regimen when you become pregnant that you go through as you progress in your pregnancy. One of the things that you are needed to do is complete a glucose test around 24 to 28 weeks of pregnancy. That test requires you to drink a very sugary drink, and then you get your blood drawn, and it tests for gestational diabetes. This sets up the remainder of the pregnancy to know if there's any additional lab tests that need to be made, or if there's insulin that needs to be given, or if the baby needs to be delivered early. Lots of different things that this can factor into. And so there was one particular patient that I worked with who was in a period of fasting due to religious reasons, and she felt really uncomfortable completing her glucose test due to her religious fasting. We explained that this was medically necessary and that her religion did put out a notification that this was an appropriate test to be completed because it was medically needed. The patient still didn't feel that comfortable due to her cultural values and her religious values. On page 28 of the textbook Health Promotion Throughout the Lifespan by Edelman and Kudzma, they explain that values are beliefs about the worth of something and serve as standards that influence behavior and thinking. And so for this patient, her religious values triumphed completing this test. And so understanding that as a healthcare professional, I was very adamant about the completion of the test. I knew the repercussions that would happen if the test wasn't completed and the risks that were associated with not completing the test. But I had to use my therapeutic communication with this particular patient, and we had to decide a plan for the patient so that way she could feel like her values were being respected in the healthcare field, and we felt more comfortable with the process of her care. And so this was an extremely important experience for me to have, to be able to be fully well-rounded in therapeutic relationships and therapeutic communication. Thank you.